My name is Jane Mosley. This is XNB382 Assessment 1, an initial client consultation. I will begin this presentation with an introduction to my client, followed by an overview of the pre-exercise screening tools used. This will be followed by a summary of consult notes, including 3 goals that will direct the needs analysis. The presentation will conclude with a summary of our full consultation and a subsequent action plan. My client is a 19-year-old female university student. She weighs 49 kilograms, is 165 centimeters tall, and therefore has a BMI of 17.8 kilograms per meter squared. Her resting blood pressure was 126 over 72 millimeters of mercury, which is a normal value. She is also currently meeting the National Recommended Physical Activity Guidelines. My client gave her explicit informed consent to having these measurements taken. Using the QUT Health Clinic's new client screen, I gained basic lifestyle and history information. Her reason for appointment was her chronic neck pain and headaches after long periods of sitting. Her medical history includes scoliosis in 2011, which she has ceased treatment for. She participates in 2 90-minute aerobic and resistance training sessions each week for a total of 180 minutes moderate to vigorous activity. She also studies full-time and works part-time, living with her parents and sister in the family home. The Exercise and Sports Science Australia Adult Pre-Exercise Screen is a 3-stage assessment used to identify individuals who may have an increased risk of an adverse event while exercising. Stage 1 is self-administered and compulsory, while stages 2 and 3 are administered by the treating practitioner and are optional. If the client answers no to all stage 1 items, they may participate in moderate exercise. For stages 2 and 3, the client must accumulate less than 2 risk factors to participate in vigorous exercise. My client completed stages 1 and 2. Her total combined risk factors was -1, classifying her as low risk, therefore she can safely participate in vigorous intensity activity without further medical clearance. My client is currently physically active. She enjoys the gym, however with her study and work commitments it's difficult to find time. She used to play tennis recreationally but stopped about 2 years ago due to these time constraints. Tennis was also an important source of social engagement for her, so she is highly motivated to return to play. She would like to improve her cardiorespiratory fitness for tennis and also for its health benefits. She expressed frustration with her lack of progress in resistance training, saying her low confidence with lifting hindered her progression. My client was diagnosed with scoliosis of the thoracic spine in 2011. After 6 months of physiotherapy, her condition was improved and no further treatment was sought. Since stopping therapy, her condition has regressed. She has daily neck pain and headaches, exacerbated by long periods of sitting. She relieves her pain through stretching and self-manipulation of the upper trapezius and cervical extensors. The client also consistently emphasized her poor posture as the cause of her pain. Her BMI of 17.8 classifies her as underweight, however her body fat percentage is within normal parameters for a female of her age and activity level. My client established 3 goals that she would like to achieve. Her health goal, improve her fitness for tennis and her health. Her behavioral goal, improve her time management skills to increase the number of exercise sessions per week. And her exercise goal is to increase muscular strength to aid her progression in the gym and improve her posture. These 3 goals will help facilitate my client's return to playing tennis. Tennis is characterized by high-intensity efforts interspersed with low-intensity activity varying in duration, including active recovery periods. In a match, players work at 70 to 90% of their heart rate max and 50 to 60% of their VO2 max, although intensity can increase depending on gameplay. Generalized muscle strength is required, but particularly for the upper body and rotator cuff muscle groups for serve and volley actions. There is an element of stroke accuracy performed under conditions of rapid perceptual processing as well. Therefore, to meet the demands of tennis, players must have a high anaerobic and aerobic capacity, muscular strength, and develop skill-related components of fitness like agility and reaction time. In summary, my client was cleared to participate in exercise and is already active. She is underweight, however has a normal body fat percentage. She loves exercise but struggles to find more time and lacks confidence with heavy resistance training. She was diagnosed with scoliosis but discontinued therapy after 6 months. Since stopping therapy, her pain has increased and her posture has worsened. 3 goals were established: increase fitness, improve time management, and increase muscular strength. My action plan for my client begins with a postural assessment and further referral to her GP. Due to her history of scoliosis, reassessment of her condition is pertinent before we progress. Pending the referral outcome, I must work with my client's schedule to determine the most appropriate location, time, and format for her to undertake my program, and provide her with time management strategies. For the programming phase, I will firstly establish her baseline fitness and strength. The prescription will include aerobic and anaerobic components to build fitness. With my client's low confidence in weight training, I will assess her current technique and build a strong technical foundation to help develop her confidence and promote safety while lifting. Eventually, we will progressively apply overload to stimulate general strength gains and hypertrophy, later focusing on tennis-specific movement patterns. Finally, I will periodically evaluate my client's progress using the initial measures as a baseline to assess the effectiveness of the intervention, demonstrate tangible changes to my client, and modify as necessary.